Have you ever wondered why you might wake up and the eyes feel crusted shut? There are various etiologies behind this. If it's happening over and over again, particularly in chronic cases, it's usually an indication that you might be suffering from either overnight dryness of the eyes. Mucus is one of the most beneficial things that the eyes try to do in order to heal itself from dryness, especially overnight. And then secondarily, you could be suffering from something called blepharitis. Blepharitis, bleph means eyelid, and then itis means inflammation. And there are various kinds of blepharitis. You should absolutely see your eye doctor so that they can make the appropriate diagnosis. If your coworker turns to you and says, hey, your eye looks like it's full of blood, and you look in the mirror and you might notice some bleeding on the front of the eye without pain, without irritation, it is most likely something called a subconjunctival hemorrhage. Sub being underneath, the conjunctiva being the tissue on the front of the eye, and then hemorrhage being a little nicked blood vessel and causing bleeding. If you feel you are suffering from a subconjunctival hemorrhage, the good news is that it looks a lot worse than it is. However, this being said, you should consult with your eye care provider, because if you have any kind of bleeding going on in the front of the eye, it's important to rule out any kind of underlying vascular cause, whether there's a vascular anomaly there, and that there's no bleeding going on inside the eye. So if you're somebody who has been using eye drops for your dry eye with little to no relief, it could be an indication that there might be something else at play in the factor of your dryness. Whether it's the lids, whether it's the quality of the tears themselves, there are various other kinds of diseases that can play a role with discomfort from what you may find as dryness. So it would be very important to see your eye care doctor so that they can discern between these different etiologies. The most common ocular emergencies is a scratched cornea or corneal abrasion. These can be extremely painful. Let's say your toddler was having a meltdown and they scratched you in the eye. It is important that you call your nearest eye care provider that day. Do not wait to be seen, because number one, they can help you feel a lot better from a comfort perspective, but number two, it's important that they are able to start you on some form of an antibiotic or other treatments if necessary, because now you might have a little open wound to the eye, and that is at risk for infection.